Good afternoon. Thanks for joining us for our Tuesday briefing today. I had the privilege this week of starting off the week by going first thing Monday to rural West Tennessee, to the Obion County Central High School, where we met with teachers who are preparing to welcome students back to their classrooms. Commissioner Schwinn and I were there to hand out among other things, to hand out kits for teachers that have masks and disinfectant wipes and gloves. 80,000 such kits we'll be handing out to teachers for every classroom in this state. And that's something that our state was the first to do, and we were proud to be there to deliver those. To put that in context, it takes about 50 truckloads just for the disinfectant wipes. So it's been a lot of work to get those out, but we are grateful to our TEMA group, our team at TEMA. Patrick Sheehan is here with us today to answer questions about that if anybody has it, but we've worked with TEMA and the National Guard. We've also had help from private partners. FedEx has been a great partner with us in determining the logistics and how to get those packets out, those 80,000 packets out. We're also grateful for Pfizer Corporation, who gave our state a $250,000 grant to provide touchless thermometers. So those will be accessible to school districts all across the state. School year brings challenges. It brings opportunities for students, but it brings a great deal of challenges as well. And this month, Maria, my wife Maria, the First Lady, her Tennessee Serves initiative is providing opportunities for folks all across the state to collect and donate school supplies to classrooms. COVID-19's created a significant financial strain for a lot of families, and the costs of going back to school are significant to them. A backpack full of supplies and extra box of crayons is a welcome sight to many families. So I encourage Tennesseans to go to the First Lady's website at tn.gov and see how they can participate, how they can be a part of making contributions, of collecting supplies for kids, and making it just a little bit easier for families as they take their kids back to school. Thursday we'll have Commissioner Schwinn at our press briefing on Thursday. We'll dedicate that press briefing primarily to opening of schools and everything associated with that. She's out in the counties right now visiting with school districts, as she was with me yesterday. Excuse me, but she'll be doing that throughout the week. So we'll have that special briefing on Thursday. I want to talk a little bit about the special session. I've called the legislature together to meet next Monday to take up legislation that we were working on but that wasn't complete at the last session, specifically extending liability protections to businesses and schools and nonprofits and healthcare workers and organizations across the state to protect those from frivolous laws. Excuse me, could you get me some water, please? Frivolous lawsuits associated with COVID-19. Organizations and individuals are facing enough uncertainty, and we need to make sure that they have that certainty of liability protection going forward. So we'll be working on that. The General Assembly also will look to expand and address the need for telehealth, particularly in a time when Tennesseans, we can modernize our healthcare system to give Tennesseans more flexibility and access to coverage through the pandemic and beyond. So we'll be working on that telehealth piece of legislation. There's a third piece of business that the legislature will take up that will address laws governing the Capitol grounds and surrounding areas when it comes to issues like vandalism, defacement, or other offenses against state property. I want to thank Lieutenant Governor McNally and Speaker Sexton. They have, in particular, along with leadership in both chambers, been working hard to put together the pieces of this legislation. The administration will be bringing forth these bills, but it's taken a lot of work to get us to the point where we are today so that when we get into the special session, we can accomplish what needs to get done there. Also want to thank Lieutenant Governor and Speaker, along with the Comptroller, members of the legislature, both Democrats and Republicans, who've come together to create the Financial Stimulus Accountability Group that we have put together to make decisions around the coronavirus relief funding that we've received from the federal government. This funding is intended to support relief and support for issues around COVID. It has to be spent by the end of the year or we have to return it, so we are developing a plan to make sure that those funds are spent wisely. With the help of this bipartisan group, we're not only providing support to businesses, as has been identified, but also to K through 12, higher education, nonprofits, and local governments. So far, more than $100 million has been distributed to Tennessee businesses, small businesses across the state, and we want to make sure that we communicate with as many of those small businesses as possible, because all of them have not accessed those funds. They need to go to the Department of Revenue website to provide the information necessary for them to get the checks that are due them and that are coming their way. So we encourage that. There's been, besides that $100 million so far, $81 million has been distributed to K-12 and to higher education institutions for safe opening of schools. $150 million is coming online this month to go to support nonprofits across the state that are serving Tennesseans in a number of ways through this COVID-19 pandemic. And local governments also have access to $115 million in grants. This is in addition to the $200 million that previously was set aside through the budget by the General Assembly. Dedicated stewardship means that we are serving our customers through this coronavirus relief funding. And our customers are hardworking taxpayers of Tennessee, and we want to make sure that we do that in a fiscally responsible way, and that's what this accountability group is set up to do. In the coming weeks, we're going to have next steps for programming that includes agricultural relief, housing relief, diverse business enterprise programming with input from minority-owned banks. So a number of those programs will be announced in the coming weeks as we continue to steward the funds that have come to us from the federal government to those here in Tennessee that need it most. I want to take a moment just to thank the National Guard. General Holmes and his leadership has been important in supporting our airmen and our soldiers who have been fanned out all across this state. I'm grateful for the Trump administration who has extended their support for, and primarily this is funding for the National Guard in its efforts to help with COVID-19 relief. You've seen the National Guard at testing centers all over the state, making food distributions to schools, delivering PPE to every county in our state. And many of these guardsmen, men and women who are serving, have spent a lot of time away from their families dedicated to serving Tennesseans. I thank General Holmes, but most importantly, I thank the men and women of the National Guard who continue to be and will continue to be a really important part of how it is that we address the pandemic. With a crisis of this magnitude that has been sustained for this period of time and that will go on into the near future, we are all called, every single one of us, as we've said from the very beginning of this pandemic, to have an individual responsibility to being a part of how it is that we fight COVID-19 in our state. It means that each one of us has to take up new habits and have taken up new habits like social distancing habits, like frequent hand washing or staying home when you're sick, and like wearing a mask. If wearing a mask isn't a part of your regular routine, I want to encourage you that it is one simple way that you can participate and contribute to how it is that we each come together to fight the spread of COVID-19 in Tennessee. There are several local leaders, and I have said many times before, I think cooperation with and work with local leaders is the way to get this done. There are several local leaders who are modeling the way when it comes to wearing masks and leading their communities in many ways through a very challenging situation. I want to recognize and thank them: Fayette County Mayor Ray Taylor, Tipton County Executive Jeff Huffman, Henry County Mayor Brent Greer, and Hamlin County Mayor Bill Britton just this week announced their mask requirements for their citizens to help protect the people in their community and to help us spread the word that masks are an important part of fighting this COVID-19. Almost 70% of our population are now under mask requirements, and we know that is helping us to mitigate the spread of COVID-19. We'll have reports now. I've asked Commissioner McCord to join us today to provide a brief report regarding unemployment, many of the questions and issues that have come up regarding unemployment in our state. Unemployment has hit hard. Many Tennesseans are out of work as a result of this pandemic, and we want to serve them in the best way possible in this state. It's been a tremendous challenge, as we all know, but Commissioner McCord, if you would come up and give your report. I will say also Dr. Dunn, our epidemiologist in Department of Health, will be giving a report today. He's been responsible primarily, in large part, for our testing strategy, so I wanted him to give the health report today. Commissioner Schwinn, as I said, will be with us on Thursday for school reopening plan, and we'll address more specifics of that. So, Commissioner McCord. Thank you, sir.
Hey, good afternoon. I do want to touch on a topic that I know is important to a lot of Tennesseans and people are seeking clarity to that's new to us, and that is the topic of the federal pandemic unemployment compensation, also known as the additional $600. Over $4 billion of federal unemployment insurance has been distributed throughout the state since March 15th, since we started. A large percentage of that is that additional $600. And as we know, that ended on July 25th. I think it's important for folks to know, though, that if an eligible claim is filed and certified on or before July 25th, they're still eligible for that $600 up until July 25th. We have a lot of questions about will some supplemental unemployment insurance be added. We're in constant communication with our federal partners, and we're trying to understand what it will be. We are pretty sure that it will be something, but we quite frankly don't know what that is yet. So we're waiting to see, just like everyone else is. Our emphasis is on implementation. As you can imagine, a new program coming in, and so we've given quite a bit of feedback to the federal government about that. Once legislation is passed, USDOL will have to take some time to provide guidance, and that's basically, since it is a federal program, the instructions on how you do that federal program, and then we'll have to turn around and implement it. And we have emphasized, as have our sister states, that as soon as we can get that guidance, the better, because we know as soon as that legislation's passed, the clock is ticking, and folks are ready for whatever that may be to start being implemented. So with that, Governor, that's what I have.
Commissioner McCord will be available for questions too when we do Q&A in a few minutes. Dr. Dunn, would you give a health report?
Thank you, Governor Lee. Good afternoon. Thank you for the opportunity to share this update from TDH, the Department of Health, and the Unified Command Group. We're encouraged today by modest declines in the number of new COVID cases, but we know that we face important challenges ahead. We must continue to take actions personally, as Governor Lee said, and in our communities to prevent the spread of the virus. We're asking Tennesseans to continue to take simple actions to slow COVID-19. Your decisions help fight COVID-19 when you're practicing social distancing, when you wash or sanitize your hands, and when you wear a face covering. Today, the Tennessee Department of Health is reporting a total of 112,441 cases, including 1,805 new cases. As a reminder, COVID-19 testing remains important and available statewide. We continue to monitor and work with clinical laboratories to increase the speed of testing. Notably, your Tennessee State Laboratory recently passed a milestone of conducting over 100,000 COVID tests. While we continue to make testing accessible to all Tennesseans, we want to strongly encourage persons with symptoms of COVID to talk to their medical provider and get tested. As we've learned during the pandemic, early medical assessment, testing, and appropriate health care can not only lead to a better health outcome, but also helps with slowing community spread as health officials reach out to cases and their close contacts. As mentioned, some parts of our states appear to have stabilized or slowed in the number of new cases. However, other regions of the state are still experiencing large daily increases, especially some of our rural areas. Statewide, our hospital assets continue to be stable, although rural areas have seen an increased number of COVID hospitalizations as expected as cases have risen. We're continuing to monitor the situation closely and support hospital systems statewide. While some of the news is promising in today's report, other news is sobering. Notably, since our last press briefing, we've surpassed 1,000 deaths in Tennessee due to COVID-19. Around 80% of those deaths have been among persons older than 60 years of age. Today, we're reporting 25 new deaths for a total of 1,117 lives lost from COVID infection. This is a solemn reminder of the pandemic's toll and the impact on families and persons who have lost loved ones. Our thoughts and prayers are with you. This is also a compelling reminder for everyone in Tennessee to do what you can to limit the spread of COVID-19, not only for yourself, but for your community.
Actually going to reopen safely.
Yeah, we've done a lot of work around that, as you know. We also know we're going to have cases. We developed a very clear protocol that has been given to individual districts. And that protocol is based on community spread in a county. So it's different for different counties depending on the level of virus that exists in their community. Those protocols give them guidance on when to close a classroom, when to cordon off a hallway or a wing or a school, and those districts have that information. That combined with the protection for teachers, those are just a couple of examples of how we believe we've set aside and put forth guidance that will allow for safe reopening.
You frequently said that nothing is off the table when it comes to combating COVID-19, yet you've ruled out statewide mask orders, closing bars, limiting dining in restaurants, and shutting down the state's economy once again. What exactly remains on the table, and what are you doing besides just expanded testing, PSAs, and urging Tennesseans to do their part?
You know, I think everything is always on the table given we don't know what the future holds. Where we are today, where the virus is today, we're implementing the things that we think are appropriate responses to the spread of the virus in our state today. But as I said, we don't know what the future holds. I have, from the beginning, tried to be one who looks at where we are and have changed positions at times based on spread of the virus or caseload in a community, and that's the way we'll do it going forward. We'll just follow the information that is on the ground and make decisions as such.
And then one last quick question. Your special session call had 3 topics. Did you consider any other legislation, including ones more directly related to the pandemic, including, maybe waiving the no excuse requirement for voting in the November election, or implementing a moratorium on evictions, or anything else that, sort of Tennesseans, maybe even increasing the unemployment benefit for the state? Did you think about anything else?
Well, we certainly consider a lot of opportunities. A special session is a unique situation. We need it to be narrowly focused so that we can get the work done and be certain of what we're going to get done. So we certainly considered a lot of things, but we took up what we thought were pieces of legislation that were underway when the session closed last time, and that both speakers felt like needed to be completed and finished, and so that's what we put in the call.
One of the topics that you got for the special session deals with the defacing of property and control of state capital and surrounding grounds. Why not something that deals with police brutality? I know that the Democrats had introduced some legislation dealing with that in light of all of the uproar, protests, and so forth. Why not go that direction?
I think we had a press briefing here a month or so ago where we brought together members of law enforcement, TBI, sheriff's departments, highway patrol, and to begin the process of developing a strategy to minimize police brutality, to make reforms to our policing that are appropriate for the day, and that work's ongoing. That will be ongoing. That's an ongoing effort. There are opportunities for legislation in the regular session that'll begin in January. So we brought forth what we thought was most important to get done right now in the midst of this pandemic.
Well, if you've already taken steps though with the task force, why not have the legislature do something to show that you're really serious about it?
We're very serious about it. That's why we put together that group and why we're continuing to work on that. We're very serious about it. So we determined what was most important for this special session, and that's what we called.
Good afternoon, Governor. Thanks for taking questions today. I'm curious to know what changed in terms of now saying that the city's going to report cases and track the cases of COVID-19 in the schools. The reason I ask is because a few hours ago, the Department of Education defended their decision to not publish these numbers to WPLN News. The department said in a statement that it was not going to collect data regarding COVID-19 cases on the school and district level, since we'll be tracking cases of COVID-19 within their school communities, but that they were not going to make it public.
Yeah. So I'll just say we've had a lot of discussion. I believe that we have to protect privacy, but we also have to be transparent, and that policy change hadn't been made yet. It'll be, as I said, it'll be announced in another week or so, but and we haven't communicated that with every department because we haven't created that policy change, but we're working on that right now.
When you're telling us, I just want to be like for you to be definitive, we will know the number of cases in school districts across the state.
Well, we will give you a plan within a week of what information it is that we're going to provide, with the intent of being more transparent so that communities know what's happening in schools with regard to COVID. I can't tell you exactly what we'll be reporting for every school or every classroom, but we'll have a plan that increases transparency around reporting and protects the privacy of folks' health.
I have a question about this special session. You said it has taken a lot of work to get to a place an agreement so that when the legislature comes back next week, they can be successful and pass the COVID-19 liability bill. Is this new bill going to be retroactive? I mean, this is one of the points where the two chambers disagree.
Right. There is retroactivity in the limited liability protection bill. That the draft of that bill is almost complete, and there is a level of retroactivity to that.
And so it feels like this was negotiated in a way behind the scenes, because the public was not part of this discussion, the press was not part of this discussion or any meeting where these differences were hashed out. Why do it this way?
Well, to be clear, we will make a proposal to the legislature, but then it will be hashed out, right? It will be determined what is done. The administration will, based on conversations we've had about what members want, we will deliver a piece of legislation as we always do, and then the General Assembly will debate that, discuss it, have committee, it'll be open, and that's how that process will work, just like it does with any piece of legislation.
Thank you.
Hey, Governor, coming back to the transparency issue, this isn't the first time your administration has initially refused to give out information and then decided, okay, we will release this COVID-related
Yep.
information. I guess I'm curious, does your administration have a transparency issue where your leaders are saying no and then reversing course? Is that an effective way during a pandemic?
You know, this pandemic is something that none of us faced before, and the issues around what to report and what not to report are all brand new. We also recognize that this is a health crisis and that privacy around personal information around someone's health is incredibly important. And it's a real balance to determine how to protect that privacy, but at the same time to give transparency to folks that need to know. And, so these issues have been brought up uniquely for the first time, and we assess those and make determinations on them as we go along. I think it's been, I think we have moved toward transparency every time we can, starting with patient protection and privacy, and I think it's been a good process.
Talking about COVID liability real quickly, I believe you just told the land that retroactivity is going to be part of the bill. There were several lawmakers who said on the House floor that such measure is illegal and unconstitutional. Why is that in your mind? Why is it legal to have a retroactive measure in this bill?
Well, we believe the way that we've constructed this bill, it falls within the confines of the Constitution, so that makes it constitutionally sound. But that'll be discussed by the legislature as we bring it. We'll deliver it, and then they will debate it and determine the exact language of the bill once it's done.
Governor, you were pretty emphatic last week that schools needed to reopen. But the CDC says you've got to get the virus under control first. Dr. Burks says the same thing. The American Academy of Pediatrics says the same thing. So does a recent Harvard study. Do you have any independent scientific experts you can point to tell you that now is the right time to reopen?
Well, we know, as I said earlier, for example, that child abuse cases have dropped by 25% since kids have gotten out of the classroom. We suspect that child abuse hasn't dropped by 25%, but the number one reporting mechanism for child abuse is a teacher with eyes on the kids that they love and teach and serve. That's one clear piece of evidence that a child in an unstable home is better in a classroom than they are out of the classroom. There are mental health services for children who have mental health needs, and those services are available primarily through the school. Many families don't have access to those services when their kid's not in the classroom, and mental health is a tremendous health need for our children. Those are just a couple of examples of the multiple documented reasons why kids fare well in a classroom setting. It's one of the reasons that we want to give parents an opportunity. What's important to remember here is parents will have a choice. In every school district in Tennessee, if a parent doesn't feel safe for their child to go back into their school, they will have an option for online learning. We've made that available for every district in the state. So we do think it's important that kids get back in the classroom, but we also think it's important that parents have the option to choose whether or not they think that classroom is safe and what's best for their kid.
But all of the experts at the federal level say you've got to get the pandemic under control first before you can deal with those issues. Do you have a single scientific expert who tells you they are wrong?
I have, as I said, we have clear evidence.
But about getting the pandemic under control.
Well, to be clear, we have worked and continue to work every day to mitigate the spread of that pandemic in this state. We're encouraged by the numbers. We're encouraged by declining cases in our metro areas. We have sufficient healthcare capacity in our state. We have one of the lower, relative to the size of our state, deaths per capita in Tennessee. So we're working really hard to mitigate and to get this virus and then keep this virus under control in our state. So we think that it's important to provide a safe option for families to keep their kids out of school if they want them, but to provide in school for those families who believe it's best for their kids.
But just to be clear, you don't have an expert you can point to who says now is the time to reopen?
25% of child abuse cases in our state is a very clear reason that I believe that we should protect children in this state and get them back into the classroom, along with a number of other reasons that we think it's best for kids to go back to school.
About the special session, if school systems open in defiance of the federal health guidelines, why should they get liability protection?
Yeah, school districts have individual authority as to opening. We've given those school districts, and as you've seen, there are some in this state who are not opening in person today. But we also believe that because it's best for kids to be in the classroom and for schools to open, that we also need to provide them an environment that protects them against frivolous lawsuits. Not only schools, but businesses, nonprofits, organizations, individuals, healthcare
This may
workers.
be a question for Dr. Dunn, but it appears that testing capacity has dropped dramatically this week. If you do not have the ability to test, can you safely reopen schools?
Dr. Dunn, I'll let you address it. My understanding is we have plenty of testing capacity. We have the ability to test. Our greatest challenge is in test turnaround time, but can you add to that?
Yeah, it's interesting with our perspective on testing. Back in May, we were very hopeful to get up around 5,000 to 6,000 tests a day and per day. Over the last week or so, we've been averaging about 25,000 to 30,000 tests reported to the state per day. So we're still seeing high levels of testing. We're up over 10,000 tests reported for today's numbers. And we continue to monitor that with our commercial labs and with our state laboratory. We've been committed throughout the pandemic to making testing widely available. We think it's still a very important part of the response so that we can identify cases, do isolation, identify their contacts, do monitoring. So we think we're in good shape with testing assets.
Chris?
With hundreds of thousands of Tennesseans losing their federal $600 payment, is there any real discussions at the state level about what could be done with Washington dithering around on this? And that's a real issue with
Yeah.
affecting a whole bunch of folks.
Yeah, it is a real issue, and we certainly hope that the federal government comes together and makes a plan and develops a plan. At the state level, we're not discussing a bridge or filling in that gap, but we don't have the resources to do that, but we do believe that, we do hope that the federal government will come together and develop a strategy going forward.
And the second question, with respect to the First Amendment, balancing that with protesters and public property, with that third element that's part of the call of the special session, how was that balanced?
You know, we've had a lot of protests. We've had protests of 10,000 people in our city that were peaceful and that were managed well, and that where there was no laws broken, no property defaced. We respect and appreciate the protection of the First Amendment in this state and in this country. It's part of what has made this country what it is today. We want to make sure that that ability to provide that protection for those who want to exercise their First Amendment right, that it is done so, and that is done so peaceably, that is done so without property damage, that is done so with protection from law enforcement who are protecting protesters. And that's how we balance that, and that's what the attempt will be going forward. Great. Thank you all for being here. I want to remind you that, I want to remind every Tennessean that Election Day is Thursday. We need every Tennessean to exercise their right to vote. Get out there, go to a polling place, make sure that you let your voice be heard in the ballot box. It's an important tradition, and not just a tradition, it's an important piece of this country and of sustaining this democracy. Maria and I voted early last week. We wore a mask. We encourage every Tennessean to wear a mask when they go to the polling stations this Thursday to protect not only themselves, but to protect those poll workers that are out there. You will not be turned away from a polling station for not wearing a mask, but we would encourage every one of you to do so, to make sure that we have safe elections, not only free and fair, but also safe. So thank you for joining us today. Thursday we'll have another briefing. We'll focus, Commissioner Schwinn will be here. We'll have a number of topics, but we'll be focusing on getting back to school. Thank you. Thank you, sir.
Thank you, sir.
Appreciate
Sorry,
you.
allergies.
Yeah.
Just
Yeah.
Sending wood. Thank you.
Yep. Thank you.